at 21 years old, I was a college student and I was dating a guy, and my brother had met the gentleman in a restaurant and had shot him and then turned the gun on himself and took his own life. So at that time, I really sought help, and I got in the mental health system at that age after that incident. It was very traumatic and I needed help.
Hey, welcome back to Normalize the Conversation. Today I'm here with Candace Jones. Candace has some lived experience within the psychiatric system, within this mental health system, that she is so excited to share with us today and bring some amazing, eye-opening information to the forefront. So Candace, thank you so much for joining me today. How are you really?
I'm in a good mindset today, and I've been in a good mindset for a while now. I just continue with my medication and seeking therapist help and getting as much help from resources that are available.
Medication and therapy and resources is just so undervalued. I don't think people realize how helpful it can actually be when you get that treatment plan that's working for you. When we spoke previously, we had this really very eye-opening discussion on the current mental health system from your experience. So before we dive too deep into the system and to our conversation, I was wondering if you would mind sharing some of your mental health journey with us.
Yeah, I'd love to. At 21 years old, I was a college student and I was dating a guy, and my brother had met the gentleman in a restaurant and had shot him and then turned the gun on himself and took his own life. So at that time, I really sought help, and I got in the mental health system at that age after that incident. It was very traumatic and I needed help to go through. And with my family and friends, mental health had always been kind of a taboo subject and it really wasn't spoken about in my household. So it was a lot to take on and to dive deep into these emotions that I was feeling. And I have serious PTSD from it. And that is where I began my mental health journey. And I was in Louisiana then. And my mom actually told me I needed to go stay with my aunt and uncle in Delaware. So I transferred over. I was in a mental health facility for about 2 or 3 months, rehabilitating from the incident. And then from there, I moved in with my aunt and uncle, where I got a psychiatrist and a team together to help me with my mental health.
First of all, thank you so much for being so open and vulnerable and sharing with us. I know that's not an easy thing to talk about, so thank you so much, and for being so willing to have this conversation. You really entered the mental health system at 21 years old. You are so young, and not being able to stay with your mom and your mom sending you away to your aunt and uncle also can be very devastating and heartbreaking at such a young age when you are struggling. So emotionally, what was it like being in that system at such a young age?
It was overwhelming because you get put in this system that you know nothing about. Like I didn't know a lot about mental health help. I didn't know these resources that were available, and I kind of took it for granted at first. I just thought, and I was on Medicaid, so I don't know what I was thinking, but I felt like I deserved the help, and and I needed the help. But there are flaws in the system, and there are things that could be done better, to better assist. And then, on the other hand, you have where there's people who really care in the system and really want and value you and want you to do better and aspire to get out of the system. But since I was 21, I've been in and out of mental health facilities. I'm 32 years old now. And it's tough because I want to do better. I want to go somewhere. I want to be a contributing citizen. You know, I don't want to just live off of a system. So,
11 years of being in the mental health system is a very long time to still be kind of going through different struggles within it and have a lack of information because there's not enough conversations about it. People don't know what to expect. What's the best piece of advice or information you could offer someone who is young going into the psychiatric system, the mental health system, and knows nothing about it?
Your social worker is so important. You do not realize what the job they take on and the resources they have available for you. That is your way to bettering yourself. That is, I understand the psychiatrists are there and they have a very important job, but the emotions I feel towards the social workers that have been able to put me in better positions so that I can better myself in other situations is really, really, touching. And those are relationships I really remember.
Thank you for sharing that. I don't think people realize that a social worker can be so helpful or that they're able to provide you resources. I think people see social workers and look at it as someone who helps kind of kids in placement, and they don't know how much extra they offer and the resources they have. So you brought a lot of light to such an important resource. When we first spoke, we talked about how on top of this emotional journey you went through, you also had physical recovery. So what was that journey like when you're trying to recover both emotionally and physically?
Well, let me go back a little bit. When I was really contemplating suicide at one point, and I actually had an attempt. I jumped 35 feet on the concrete. That's when I was in a wheelchair for 8 months, and I didn't reach out, for any this was after my brother when I was in Delaware. And I didn't reach out for any mental health because I didn't feel like I was getting the help there anyway. And I was like, no one can help me. All these resources are available, all these people that I should have these relationships with. And I felt alone. And that's what happens with mental health. You isolate. And I isolated. And I decided that it wasn't worth it. It wasn't worth going through the mental hospital and leaving my home to seek help because I wasn't really getting help anyway, is what I felt like. And so, like I said, I tried taking my own life. I jumped 35 feet on the concrete. And I remember waking up in the hospital and still having the daunting thoughts, as well as going through the physical pain I was going through. I was in pretty much a full body cast for a while. And then I got into just like leg cast, and my elbow was broken, and I have a nice little scar on my forehead. But I was in a wheelchair for 8 months rehabilitating physically. But that wasn't all I was doing. Like you said, Fran, I was also rehabilitating mentally. I had to rethink my mindset. I had to get out of this emotions that I was in. I was dealing with a stillborn. I had a stillborn, and I was dealing with her death on top of having anxiety and depression, and the traumatic event that happened to me in Louisiana when I was 21. And it was difficult, to really reach out after that. And these places that I didn't think would help, some of them really didn't. Some of them, I had a doctor one time make a joke about me jumping. And I was just disturbed. I just couldn't believe that he found some type of humor in the situation. I don't think he realized to the point of how critical it was. I will say that on his behalf. but I made sure not to see that psychiatrist again. You know, it took some soul searching for me to, you know, find healthy coping skills. I had to reach out to friends and family. And Fran, I wish I could say that, you know, I had a therapist and psychiatrist guide me through all this, but I really didn't. You know, I had to really kind of come on my own. Things did get better though. There was, you know, after the healing, and I reached out to friends and family and coping skills and tried to rebuild relationships and handle my daughter's death on my own. I started reaching out again for therapy. And it was helpful, you know, to let someone know, look, I didn't feel like I could get help, or, you know, the help that was available wasn't enough. You know, that's kind of where I'm at with it. You know, I don't want to say that the system was there for me when it wasn't.
First of all, again, thank you for being so open and vulnerable. And I'm so sorry for everything you've gone through.
Thank you.
But for you to be on the other side now, sharing what you've gone through, sharing the negatives within the system that's not available, sharing the lack of awareness of resources that are available. Because again, we don't learn this growing up. No one tells us where to reach out for help, how to reach out for help, what to say, who to say it to. We're not taught any of this. So for you to have gone from a point of attempting suicide to a point where you are actively bringing awareness and having these conversations, it's beyond incredible. And I really hope you take time to celebrate that, because not many people are able to do that.
Thank you. That means a lot.
Now, looking back now on your journey in the hospital and the psych ward, what were some of the biggest positives and biggest negatives that came out of it?
You know, it was really helpful meeting people who, you know, patients just like me that were going through mental health struggles, and being able to relate to them and talk to them. And, you know, there were relationships that I built within there that I had gotten phone numbers from, and I had stayed in contact. And, you know, you don't even think about that, you know, when you go seek help, that someone else's, you know, problems could correlate with yours and help you through the issues that you're going through.
We don't realize other people are struggling and how much they're struggling, and that we're not the only one feeling the way we are until we are surrounded by people who are there. And not that I want anyone else to have to struggle and be in a psych or an attempt suicide or be high risk, but it was for me, and it sounds like for you, so comforting to know that I wasn't the only one.
Yeah.
So continuing back on what you were saying, we talked about some of the positives. What were some more of those negatives that came out of the experience?
Yeah, it was difficult because they schedule you with an aftercare program, but they don't follow up with your aftercare program. They don't check to see if you really go to your aftercare. And I've been on the substance abuse also, not just the mental health. I've been on the substance abuse side, and you know, they'll put you with aftercare and then put you on the street. And like, you're supposed to follow up with aftercare while you're living on the street. Like, let's be real. You know, you're just trying to reach your data or whatever, or reach whatever you have to put in your system so that you can move on with the day. You're not worried about if I'm going to my aftercare. And to think that, you know, sometimes I was going through some really hard mental health issues, and they had put me on the street. And it's sad because I have PTSD. I have a fixed income. I could have gotten help with something. Why do these places put us somewhere, to babysit us for a little bit and then throw us out and then wonder why we come back? Because we're not getting the help we need.
Follow-up care is so crucial. And yet, in many circumstances, especially in yours, you see that people aren't following up. I mean, I have so much respect for the concept of psych wards and for the individuals who are working to keep us safe for those 72 hours or that week or 2 weeks. But it needs to continue afterwards. Like you said, a lot of times we're brought in there, we're kept safe, and that's great. But then we're thrown back out into that same life situation or worse situation, financially worse off for the cost of being there, and expected to just figure it out. And they do book follow-up care appointments and a lot of experiences, especially my own. But like you said, didn't check to see if you're going. And a lot of people are afraid to reach out. A lot of people are afraid to take that next step. And having someone just encourage you, remind you, push you can make all the difference. Thank you so much for bringing such a connection with that powerful statement.
Yeah, thank you. And another thing I wanted to touch upon is a lot of substance abusers, struggle with mental health issues, and they separate the two. They put, the drug users in one facility. I know they do in Delaware. That's where I'm from. Well, where I'm staying. My home for my mental health, really. But they put them in a different program than those with the mental health who struggle more with depression or anxiety. And it's really sad because they overlook the drug users, and they just put that stigma on them that all they are substance abusers, and they don't realize, to dig deeper, and that there's usually a mental issue going on deeper in that person. And I think that they should, touch upon mental health a little more in those areas where, the substance abusers are, that they're struggling too with mental health. They just start finding different ways to cope with it. And the way that we're coping with it, or we're coping with it, we're really bad. We're terrible, deadly at some point. So that's another issue I think that should be, discussed, is the substance abusers getting more mental health assistance.
I didn't realize that within substance use treatment, they don't really overlap mental health. And it sounds like there's a focus on sobriety only, but what about maintenance of sobriety? What is the underlying cause? You can't just tell someone to be fixed and healed and all better when you're not looking at the underlying cause. You can't just put tape on a leaking roof and expect it to hold forever. You have to work on maintenance and giving someone all the tools that they need. I'm so happy you brought that up again. Within the mental health system, there are so many different opportunities for improvement. And as someone who has been in the system in multiple states, what are the 3 biggest opportunities for improvement that you personally would like to see?
Some 3 improvements that I think could be made is, I think that the workers, when it comes to the psychiatrists, the nurses, the social workers, even just the ones that are, I don't know what they're called, but they work in the mental health facilities. But the psych wards, they don't get enough acknowledgement for what they do. If they got more encouragement for the things that they were doing, that would be really great for them to know, how much their job really matters. And they don't hear it enough. They get burnt out on everything. And then that's when people just start becoming a number, and then they see the same patients again. And I think, some form of letters or something, from the higher places, sending them care packages or something to let them know that what they're doing matters.
Yes, I agree. And with the lack of funding, there's not enough. They're so understaffed and they're trying to take care of so many people and they are being spread way too thin. I think you're absolutely right. Providing more encouragement, more support, even more resources to them would make such a big difference. What are two more?
And not only, the second one kind of elaborates on the first, but not only getting, acknowledgement from the higher, officials, but what about the stories of people who've made it out of the mental health, or who are, I guess you always, deal with mental health, but are bettering themselves? What about those stories? Why are these patients being overlooked? These are the stories that would really make someone feel like they're doing their job, and you don't hear these stories. You just see, I know they're out there, people bettering themselves. I want to better myself and really write some letters to some people to thank them and let them know where I am on my journey. And, that patient relationship needs to be built upon, but it needs to come from the patients to these people in the mental health facilities that we take for granted sometimes.
I completely agree. And you know what? I do encouragement cards for multiple facilities for the patients, and one of them does hand them out to the staff. And I didn't realize until you said it how important that can be, because not only do we need to give hope to the patients, but hope to the people who are there, who are going through it, because they genuinely are only seeing the most difficult times, the worst time in someone's life, their lowest point. That is what they're seeing. They don't get to see the success stories, just like you said. I love that. I love that idea. I think that is absolutely amazing. What's one more opportunity?
I would like to see more opportunity with family. They in Delaware, they have this rule where you have to have one person, a contact person in the system. And that person is pretty much the go-to person to check in on whether you're feeling good or you're not feeling good. But, mental health tears family relationships because you're tearing yourself apart. Of course, you're tearing the ones that you love apart. And it's, they should be liable. Your family should be more liable on your behalf of what you're going through, and should take more initiative in your treatment program. And these mental health facilities should facilitate that so that these relationships can be built, because family is so important. It's just the basis of things, and it's the fundamentals that you're raised upon. So it's important that you have this good system working for you and working towards your family to build a better program for you.
I think it's a great idea to have more family integration opportunities. And with the stigma, there's a good chance that a lot of family members aren't going to feel comfortable, aren't going to want to. But for the few or the many that do, that can make such a huge difference. Being able to facilitate a conversation about how they're feeling. I know that if someone helped me have a conversation with my family members and my loved ones, it would have been a lot easier. Instead, it took me so long to be able to put it into words and to explain. And I think you're right. Family integration, helping family feel more included. And I don't want to say feeling responsible for someone else's struggles, but being equipped with the tools and resources to support someone who's struggling, to be part of their story, be part of the recovery. But without those tools, without the facilities providing them, most people genuinely aren't going to know what to do because no one's providing that information.
Yes, definitely. Like having your family members there, that a lot of the mental health begins at such a young age, and family involvement and can give you understanding of the issues that you went through, and then they can understand the issues that you're going through. But it does seem it's hard to get family involvement with some people, and some people don't have that family, and some have hurt relationships and aren't able to build upon them at the moment. And it's just important to remember that mental health, these facilities take time, and regaining your mental health takes time, and just feeling, letting friends and family know that you are going through mental health issues, can be debilitating to them because the stigma they have with mental health.
Yeah.
Awareness all over, about mental health is something that is just so taboo, and it just needs to be reached upon, and people need to be more familiar and educated about the things that people go through. And everyone, 1 in 3 people I think go through mental health issues. It's just it's a high number, and we don't get the help we need, and it's important that we reach out to our family and have that support.
I agree. I know the statistic internationally, I think it's internationally, is 1 in 5 people live with mental illness. And to think that 20% of people are diagnosed, right? Because we don't know how many people aren't talking about it, how many people aren't opening up. So I wonder what that statistic would be if we were normalizing the conversation and normalizing reaching out for support and normalizing getting help. If we were providing resources to people, letting them know that they're not crazy. I know in my experience, and I'd love to know yours, I was so afraid people were going to think I'm crazy. I was so afraid of the labels: crazy, lunatic, maniac, just anything, psychotic. I didn't want people to see me that way, whatever way that was. Like you said, providing these tools, providing a facilitation of a conversation could make it so much easier for people to be honest, because once you have honesty, you can begin to heal and to recover and to move forward.
I can remember back in college, there was this girl, I was at a party, and one of my friends had invited me, and he was telling me that the girl that was throwing the party had mental health issues and she was on medication. And I remember just thinking to myself, like, oh my gosh, like, what is wrong with her? And what a cruel thing to think, but I was ignorant. I was uneducated. I didn't know better. And it's sad that, you label these people crazy, or, whatever the label you give them, and the arrogance that comes behind your stereotype is just so strong, and it's so wrong. And it's just difficult, and then you go through your own mental health issues, and you say, well, nothing's wrong with me, I'm fine, nothing's wrong. And then you want to tell other people nothing's wrong with me, and just a never-ending cycle of how uneducated society is on mental health.
And because people are so uneducated on mental health, because of a lack of conversation, because of a lack of resources and tools that are being shared with us, so many more people are struggling and not reaching out for help, or struggling and getting some help and then not knowing what to do next. They're finally getting some kind of support, and then all of a sudden, like you said, when you leave, you're thrown out, and then that's it. and they don't know what to do next. So I would love to dive deeper into the lack of resources that are accessible to those who are struggling. You know, like we spoke about before, this system can take such a big toll on our financial resources, especially when they are limited to begin with. So it can be really difficult, as we said before, about figuring out what to do post psych ward. What were some of the major struggles that you faced trying to discover what to do next?
You know, this really brings it to reality. It brings it to the forefront of today, of where I'm at today. And I'm in a mommy and me program today. And I have a son, and I want to better our lives. I'm grateful that this program is here and that they are supporting me, but I would love to continue my education. And I had spoken to my therapist about looking into resources so that I can get funded and get some help financially for books and tuition so that I can get back to school. So I can become a contributing member to society, and I can raise my son and he can have a good life. And not that he's not having a good life now. The resources are available here at this Mommy and Me program. They go above and beyond the staff here. And, when it comes to getting resources, help or financial assistance with him, or, programs so that I can have the best mental health I can, they make sure that they facilitate it and it's available. But, what about, jobs and really reaching out to, education. I want to continue my education, and that's where I'm at. I'm looking into that, and I don't know what the resources are available, but when you come into these systems, they don't say, well, what's your dream? They're not like saying that, and it's sad because a lot of people with mental health issues are very intelligent, and they could heal, and they should pursue education. And that's what I'm looking through right now and seeing what is available so that I can get funding for education.
I wish you so much luck with that.
Thank you.
Is so devastating how difficult it can be to be able to move forward. I mean, you should be given the best chance. We all struggle, we all fall apart, and yet so many people are punished for it. And it's heartbreaking. So I'm really proud of you for wanting to continue the education, and I hope that you're able to find these resources, because there really is a lack of resources that set people up for success. It's not, getting support, staying afloat, that's all so helpful. But next steps, moving forward, that's a piece we need to be focusing on too.
Yes. So that's where I'm at. I want to see, and it's hard because it's such a hard thing to do, to move forward. It's like it's like a puzzle piece. It's like you have all these pieces and you're trying to piece it together, and it can be difficult. And, you want your mental health facilities and establishments to help you correlate these things so that they fit together and you can get your life together and move forward, so you can give back to this society, and that that's where I'm at. That's what I want to do. And that's my next endeavor is to find out these resources that are available for education, because you don't hear a lot of people in these systems say, well, I want to do this, because it's not that they don't want to do it, they don't know it's available.
Yes.
So you just sometimes, I'm one of those people. I was always one of the ones in the classroom who would ask the embarrassing question, whatever it was, or I just seem to not care, nonchalant attitude. Like, I want to know the answer. I'm sorry. I'm not worried about what you're thinking about me. I want to know what the answer is. And that attitude has helped me. It's contributed to me knowing more things that are available for me. And I realize not everyone has that same initiative, or aren't able to have that same personality trait, which is fine. And it's sad because if you don't, you can just debilitate and not know what's available, and almost get comfortable in a system that's designed to keep you in, it feels like. And that's not what this should be about. We shouldn't be keeping us in this system and just recurring. Like, that's what I feel like. Oh, Candace is in the hospital again. Oh, hey, how you doing, Candace? I'm talking the mental health people, knowing me by name and stuff. I'm ready to get out. I'm ready to do something different. And I really hope, this education works out for me.
I hope so too. Unfortunately, that is the reality for so many people who go into the psych ward, who go into the mental health system. They are just stuck in it over and over and over again, because it can be so hard to break out when you don't have the resources, you don't have the tools, you don't have the support from other people. I can tell you one of the most important things for me when I was moving through the system was having that family support and having a father and a mother who were so able and willing to step in. And I had one uncle who babysat me every single day, took me to the gym, took me to buy books, just kept me busy and kept kind of giving me coping tools and skills. But if I didn't have that, I would not be where I am today. And I don't think people realize that if you don't have that full support system behind you, who is financially able to, has the time to be able to, and is willing to do it, it can feel almost impossible for so many people to break out of the system and to come out the other side.
I feel what you're saying. Luckily my mom's coming from Louisiana next week to come visit me and Jeremiah, and we're going to go stay with my great aunt. Well, my aunt and uncle. It'll be his great aunt and uncle. And I'm hoping he gets to meet some of his cousins. It's the first family, outing that we've had since Jeremiah's been born. He's 2 months now. And, a lot of these relationships, not with my mom, but with my aunt and my uncle and my cousins, with the substance abuse, I have hurt our relationships, and it's taken time for them to accept and want to rebuild relationships with me. And, understanding that these amends are going to take time, and that support from them makes me feel so wonderful. And I really value their relationships, and having them in my corner makes me feel like I can do what I want to do. And not having that is hurtful, and it makes you go through more emotions on your mental health journey. Like, why is my family not there for me? I've been there. I've been in those situations when, the doors were closed and I couldn't have them there. And you feel alone, and it can bring you into a deep depression. It can bring you into a whole nother area of your mental health that you just question, why am I not good enough for my family? What have I done? And it feels good to be in the spot where, I'm starting to have these relationships come together, and they're starting to see me in another light. And I want to make sure that I keep that light on, and that I persevere and move forward so that they can see me in the light I want them to see me in, and these relationships can be rebuilt. Because I'm telling you, substance abuse can really hurt these relationships, and it takes a lot of time for people to heal, not just you, but the people you've hurt around you. So,
Candace, I just want to say sincerely, you are a story of hope. You may not have come out the other side yet completely. You may still be within the system and figuring things out, but you are figuring things out slowly. And I think that's the piece people really need to see. It's so easy to look at someone who's come out the other side, who's doing all these incredible things and thinking, I want to be like that, and not knowing how. But to see someone who is actively going through it, who's still willing to speak up, who's still struggling to find these resources, but pushing to find them, who's mending relationships, who's moving forward, even if it's one step at a time and it might not seem like it's getting there quick enough, but you genuinely are offering hope to people who are just starting out or walking through it step by step with you. So thank you for being that symbol of hope.
Thank you.
Candace, it has been absolutely incredible recording with you today and having this conversation. What is one last piece of advice you can offer to someone who is just starting out, trying to break through the system?
Yeah, I've learned, don't be afraid to sit through your emotions. So sometimes those feelings aren't good and you have to sit through it and it hurts. Don't get to the point where it gets where you want to hurt yourself or anything, but it's a process. Mental health takes a lot of time. It doesn't happen overnight. You're going to have good days and you're going to have bad days. Just sit through those emotions and go through them. Be okay with yourself. Be okay with where you're at. Know that there's opportunities that are available and don't be afraid to ask for those opportunities. Don't be afraid to voice your opinion on things, but also be understanding and willing to work with the people around you, not just the patients. Those are relationships you can build, but understand that they're people working and they're at a job and they get frustrated, and understanding that they have things they're going through also. You have to keep those things in mind. Be willing to work with people. Don't cut off, relationships or think someone's not important, or, make sure you humble yourself and approach everyone with a kind attitude.